I'm joined, as you'd expect, by Richard Scott. Hello, Richard.
Andy, great to see you, especially with that hat on again.
I know. Well, it's I got a hot head now. It does work. Cheap plastic on the head is a good hat. Not necessarily good for the
It,
environment, but it's good for the head.
it looks the real deal. You're a proper Santa.
I think so.
Beard, hat, what's not to like?
Well, I would agree. Right, let's jump into a question that Joe and I had for you from last week because we were talking about different sort of types of tiredness, kinda. And one of the things we said we thought actually we don't know is we were using the words tiredness and fatigue kind of interchangeably, and then we said, aren't they sort of slightly different? So we decided we'd ask a doctor.
Huh. Well, I think to be honest, it depends on how. I think most of us would say they're the same thing,
Hmm.
but it depends because you can get short-lived tiredness. You know, you've had a very busy day or you've run a marathon. That's short-lived tiredness. Whereas fatigue, we tend to think of as a longer condition. So chronic fatigue syndrome, for example, CFS. So you tend to think of fatigue as chronic, but equally, there's a lovely condition which we call TAT in medicine, TATT, tired all the time. And and these are people who it's the same as chronic fatigue. They're just working on 50, 60, maybe 40% of where they should be. So I think it depends. You have to sort of say to the person, what do you actually mean by fatigue? Is it short-lived, or really the more important thing is it a short-lived thing? Is it something obvious like you're hardly having any sleep because you've just had a new baby, or you've just started a job where you're working 80 hours a week, or is there something, is it a more of a long-term thing that's more medically concerning? So yeah, I think you have to tease out what people mean.
So fatigue, perhaps something like I don't know, a condition like ME. That would be something with fatigue, not tiredness.
Yeah, well, yes, and it's absolutely it'd be fatigue because it's by definition chronic, long-standing.
Yeah. Okay. Here's another one. I just read about the fact the NHS is struggling under a random flu strain. I don't want to talk about flu. That's not my interest. It was more to do with because we're in that season, aren't we now? The NHS is buckling. NHS, the paramedic ambulance people are saying, right, we're calling an emergency because we can't cope. It's that season. So here's a few things. How do we know? I know we've touched on this briefly, but how do we know? When do we stay at home? When do we go? When is a pain something we need to work through, something to lean away from or go and seek medical help? How do we try and help our doctors, nurses, and hospitals the most that we can do by not going unless we actually need to?
There you are. You've answered your own question. So I think, for example, I had a flu-like illness 2 or 3 weeks ago. It was very mild, definitely under par. It was mild. Certainly wouldn't need to trouble medics, but people do with those symptoms. And when it's that mild, you say, well, look, over the course of 2 to 3 weeks, you'll get better. Take some pills. But it depends how bad you are. And also, sometimes you can think it's flu when it might be something else. And I did have a good friend, sadly, die from septicemia, a bacterial blood infection, when he thought and his wife thought it was the flu. So if you're laid out, you're absolutely unable to move in bed, then at the very least, a telephone call would be helpful. If there's any rash involved, it's an emergency straight away. So I think be sensible means, how do you feel? If you're just a little bit below par, like I was, absolutely don't trouble the doctors. It'll go 7, 10 days, if you're unlucky, 3 weeks. But if you're really wiped out in bed, can't move, can't eat, can't drink, urine output's going off, and especially if there's a rash or your conscious level's affected, you're getting confused. Oh, tell us. We need to know, because you might need some support in hospital.
I wouldn't have thought the consciousness part would have been anything relevant, but I'm not a doctor. That's not my job.
Well, it can be, because I say it might be something else like septicemia or meningitis, or there may be something else going on. Most likely, it's just a very nasty flu-like illness, and if we're really concerned, then yeah, you need to be seen. And at that point, there's the decision: do we send the person in, or do we keep them at home? Depends how bad they are. So yeah, I think if you're laid up in bed, and especially if you don't seem to be getting any better after a few days, absolutely contact the doctor. That's only reasonable.
Okay, and things like, let's go for coughs and pains. If you've got a cough, at what point do you think it's just a cough, it'll go away? And at what point do you say, oh, this cough isn't going away, I perhaps need some help?
If you're not particularly ill, give it a good 3 weeks.
Oh, okay.
And if it's lingering after 3 weeks, then you need to let us know. We always say that, not least in smokers. Persistent cough over 3 weeks in a smoker can be serious. Occasionally can be cancer. So a cough that just doesn't go away, well, we need to think Why is that? And often it's just what we call a hyperreactive airways. You've got an irritation which is just persisting in the airway. It just makes you cough. But especially if there's a weight loss, you're a smoker, if you've coughed up in your blood, highly significant. There's a few other, that's why you need a decent medical history, really. Again, so see how you are. If you're not too bad, give it 3 weeks. If you're terrible right from the beginning and sweating and you can't move and you're in bed, well, maybe you picked up something worse like pneumonia. Again, doctors should be involved at that point.
Yes, I've had a chest infection. They are not fun. They don't feel like anything else I've ever had, ever. Okay, indeed. And then pain, because there's so much pain. There's muscle pain, head pain. I'm just trying to help out the NHS. If there's a few types of pain, at what point does pain become paracetamol rest? Paracetamol, no paracetamol. Painkillers, do we exercise? Do we not exercise? Do we just go to sleep? When do we want to get worried about pain?
Well, if pain is a very unpleasant symptom, it's worth a chat. I always think of pain a bit like, if my car squeaks, I can make a bad diagnosis, or I can talk to a mechanic. and it's worth doing so. So if you're getting a pain and it's not an obvious thing like you've mild twist of your ankle when you were walking along, okay, well, you could probably manage that yourself. If it's a very bad twist, we need to be involved. But if it's not obvious why you've got such a pain, yeah, I think it's worth asking what's going on here.
Okay, and let's finish with head pains, because I remember Jo was working one time doing a bit of temp work. She was working for an out-of-hours doctor's thing. It's the ones where you ring your GP, they put you to the thing rather than the hospital, okay? And one of the things that the doctor said was, who was on call, I just wish people with a headache would take paracetamol and see if it deals with it. Because if there was no pain, they wouldn't need to ring us. But they ring us, we say, take the mildest painkillers you've got, and it goes away. Could they not start with taking the painkillers first?
Totally, absolutely, totally. Because anything serious, say a terrible head infection, meningitis, or even dare I say a brain tumor, the paracetamol won't do the job. Oh, doctor, I've tried paracetamol. I've had this for 10 days. It's getting unrelentingly worse. Well, we need to see what's going on here. Yeah. And then if they've got other symptoms, eyesight changes and vomiting, then you're thinking, raised intracranial pressure, very serious combination of 3 things. Hospital. So yeah, but certainly try the paracetamol first, because as you say, most people's pains will get better. Yeah, don't come our way.
I just remember coming home one night and she said he was so frustrated. He must have obviously had a whole bunch of phone calls of just take some painkillers, and then in a couple of hours, if it's not gone away, but just take them first rather than asking the doctor.
The illustration is, for example, I've just had my one of my tires sorted out because it had a slow puncture. But the first time it went down a bit. Well, I put some air in, and it lasted 2 weeks. Then it went down a bit more. I put some air in, thinking, yeah, that's the second time. Yeah, oh dear, it's still not working. I'll go and get it looked at. It's probably a slow puncture. They say, oh, guess what? You've got a slow puncture. There we are. We put a new tire on. And by the way, there's the nail causing the trouble. But I tried. That's like taking paracetamol for your headache, but it didn't work. And if paracetamol for headache doesn't work, a bit like if you blow up a tire but it's got a nail in it, it's not going to work. You need a bit more treatment.
I guess it's trying to help us get, I suppose, in a sense, get back to understanding when do we need to see a doctor, when we don't, because in the age where we can Google everything, and when we got Dr. Google, it's not necessarily I know what I've got this really long thing, and you can see the doctor thinking, no.
Well, funny enough, that's sort of where we're going tonight, Andy.
Oh, okay.
You're a bit of a mind reader on these things, I reckon.
I sometimes am. Okay, I just thought it'd be interesting to touch on some of those things, because I saw loads of people going,
there's not enough in the press and by the politicians, because they're a bit too scared to say it. Actually, what we need to do, a big job in the NHS, is to reduce demand, not just increase supply. And if we could get rid of some of the minor stuff, then we can put more emphasis and more money and energy and effort into surgery, into the big stuff. But we've got, you can't get a quart out of a pint pot, to use an old illustration. Let's get rid of some of the smaller stuff by doing exactly what you've been saying.
Yep. No, I just thought it was relevant. COVID, of course, hospitals were empty. I went not in a good condition, nothing to do with COVID. But yeah, there was empty. And I was thinking there was going to be a 12-hour wait. And I walked in and it was amazing. It was triage nurse, and he said, "Hi, how you doing?" and checked me out. And straight to a doctor who sent me straight through. And I was thinking, what's going on? And they said, yeah, it's just absolutely, this is how it should be. It's people with serious conditions, which I had, and then we get straight away to treat it.
Yeah, no, absolutely.
Right. Okay, sir. Where would you like to go tonight?
The headline is, does labelling illness help?
Ooh.
It's a hot topic. That's
Yeah,
what we
yeah.
like to deal with on this on the show, and it's particularly related to ADHD, attention deficit hyperactivity disorder, of which there's been a huge increase in diagnoses, and the health secretary, Wes Streeting, is really getting involved. He's investigating it. Why have these diagnoses gone up? Why is it being labelled so much more than it ever used to do? Is there a lot more about than there used to be? Or are the diagnoses are not always right? Is it indeed helpful to be diagnosed with mild ADHD? So here's the pros and cons, and we're going to look at it tonight because this is all over the papers at the moment, and
Yeah, yeah.
Streeting's looking into it. So I just want to start really by talking about my own health over the years, because although I'm a retired doctor now, I've been a patient on many occasions, as indeed you have. But my first time, I didn't wait long. I was only just 2 when my appendix ruptured and Darnwell nearly killed me. Because the diagnosis was unclear. Obviously, I can't give a history. Age 2, I'm just yelling. And I was very grateful to my dad, who essentially helped to save my life. He was not a medic, but he was clear-sighted. And when the doctors were dithering, or what should we do, what should we do, he just said, open him up and find out. Smart man. He was a practical man, not a doctor, but he did the right thing. They did, and there was the perforated appendix with peritonitis. Cleaned me up, took it out, and there we go. So the diagnosis was delayed, but they got there in the end. Subsequently, I'll be on the right side of many accurate, I might say timely, medical diagnoses. I had a salivary gland stone that made me miss my Christmas dinner when I was 14. I've had adhesions in the bowels. I've had bowel cancer. I've had knee ligament damage, several operations on that, a whole load of things. But essentially, they were all helped by accurately labeling the disease correctly, in other words, allowing for the correct treatment. Which brings me back to ADHD and Wes Streeting, our health secretary, because there's been much in the paper. Very good article in this week's Sunday Times concerning, so the author of the article, I'm going to call the writer, because the writer, was talking about an author in her article who'd assumed that the reason her mind wouldn't slow down was because she had an over-fertile imagination. But when this person that she's talking about, son, was diagnosed with ADHD, this writer or this author went into full research mode, realized she ticked every box for ADHD, and 2 years later had her own diagnosis. Now, what was interesting about it was the person writing the Sunday Times article talked about her own diagnosis for anorexia and how it had been massively delayed when she was much younger. Now, she says, we seem to have come full circle, in which diagnoses for ADHD, autism, mental health disease have absolutely rocketed. Here's some stats. I like numbers, as you know, Andy. Between 2019 and 21, so just a 3-year period, there's a 3,200% increase in British women doing online ADHD tests. Wow, 32 times increase. From 2019 to 2024, so that's an overall 6-year period, the number of 16 to 34-year-old people, young people, off work with mental health conditions rose by 76%, which this figure that she describes, the writer of this article, is both nationally devastating and also socially tragic. And it's because of this massive increase, not just in mental health, but specifically in ADHD and autism, I might say, that has come to the attention of our health secretary. Because, as the writer writes, the only growth in our country at present is in welfare. So it's a good time to investigate why 5.8 million people in the UK say they are disabled by mental illness. But it's very hard to do so because it's a touchy subject. Talking about if you come out against in any way ADHD, etc., like Wes Streeting is doing in terms of saying it's being overdiagnosed, you get a lot of stick, but he's not backing down. So what pleased me overall with the article was it was very balanced. It wasn't just brave, but it was balanced, because the writer of the article said that absolutely ADHD and autism exist. They are neurological conditions and in some settings are underdiagnosed, for example, in prisons. But equally, and this is not a contradiction, in other settings, they're overdiagnosed by, if you like, possibly middle-class people going online and doing their own tests. And of course, this is hardly surprising when, if you have a label, whether it's non-binary or ADHD or whatever, it becomes a lens through which people can make sense of their life. And interestingly, the article writer said something that, of course, this is what religious people do. Yeah, we have a lens on our lives through, the Bible, through God, through what the scripture tells us. Well, other people, their lens on life is through their diagnosis. And the writer went on to say this: she spent much of the last decade writing about our current fad for labels, whether it's cisgender, neurodiverse, and how comforting it can be to have this sort of umbrella term that gives your life meaning. But she says, and I'm going to look at this at the end, she knows that labels can be very unhelpful. They can be self-fulfilling, disempowering prophecies. Equally, parents of children with severe ADHD and autism, and Andy, I remember when I was a young medical student, I was taken to a children's psychiatric ward, and I saw this 4-year-old. The first patient was a 4-year-old boy with severe autism. And I'll never forget him. He was literally in a different world to everybody else. And I thought, that is a very severe condition, really severe. Quite different from, to be honest, many children I've seen in my clinic who may have autism, may have ADHD. And this is the spectrum that the article was talking about. And how parents of severe autistic children, for example, get very frustrated by celebrities and middle-aged people who, if you like, she describes, and this is her words, not mine, who are confused by the aging process and jump on the ADHD bandwagon. And it's awful when people diminish truly debilitating diseases with dubious claims and self-diagnosis. Labels shouldn't be desirable. They shouldn't explain our lives in ways that can diminish us. So that was the article, and I'd just like to sort of summarize it very briefly, in terms of pros and cons. I think there are definite benefits to labeling, and we are talking about mental health diseases here. Access to care, validating and understanding an individual's experiences, providing a common language, reducing self-blame, and promoting empathy, where the disease is clear. But the downsides are also clear. Labels can lead to stigmatizing and stereotyping and act as a barrier to treatment of other conditions. They can become self-fulfilling prophecies. I'm not going to be able to do any good in life because I've got disease X or Y, limiting people's potential. It's going to be inevitably debilitating. So the individual or their parents or even their doctors might think, well, is that the case, really? And it leads to overemphasis on disorder and indeed can be inaccurate. So I'll be just really interested. I'll maybe keep you updated later. It's interesting to see where Wes Streeting's investigations, what they uncover, really, where they go. But whatever his conclusions, I think we need to get our mental health labeling right. I think we're into the truth as Christians, but leaving aside our faith, for everyone's sake, the patient, parents, doctors, society, we need to get our labels right. So we need to label people correctly. And if they haven't got it, they need to be unlabeled. There you go.
I remember we spoke about dementia a while ago, specifically a test that would give you a probability based on whether it thought in the future you'd have dementia or not. And I remember we spoke on that thing at the whole sort of the idea of what if you're given effectively a terminal diagnosis when you're very, 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 very young, what is the rest of your life going to be, was one of the perspectives we looked at. And basically it's going to make you ultra depressed. And why would you want to bother trying anything in your life? Now, of course, some people might, I'm going to live. That might be the case, but probably not, because you've got this just weight of a diagnosis, which is why diagnosis can help sometimes. One of Joe's former colleagues was struggling with the GPs in her local practice and hospital, and they couldn't diagnose her. In the end, she paid for a private doctor who sat there and said, it's this, got a test, treated within, I don't know, a day or something, because the GP and the NHS just didn't have the time. She was on like a 3-year waiting list, not working, thinking, this can't be that bad, got it sorted. So we know that there are pressures. And sometimes if you've got the money, that's what people are doing because it's the quickest way to get help. But of course, you need a diagnosis. And another friend of mine who was getting very frustrated with health got a private blood test. Her GP said, I can't look at this, I'm sorry, but I need to have it done properly by an organization that I can trust and know. And therefore, I can't read this for you. And she was left with this blood test she couldn't read and couldn't afford a private blood test reading. So we do have to be careful where we go for advice, information. We can end up going down a rabbit hole effectively, as well-meaning as that might have been, when Um, yeah, and it's hard, isn't it? Because we know that the NHS is stretched, as we were talking before. We know that it's struggling, but then if you got a diagnosis, you feel like I know what's wrong with me. But of course, then, as you say, that can then define who you are, what you can accomplish, what you can't do, what you can't consider, and all that. So, the 30 to 100% increase is a bit of a thing.
It's a lot. Interestingly, within my extended family, I won't say who it is, but there was one of the lads in the younger generation was diagnosed with he's on the spectrum but he's absolutely brilliant. He can do a Rubik's cube behind his back in 20 seconds or so without looking at it. And the ability was marked so that when he left university, instantly went into a very highly paid job because that sort of brilliance was determined by the skills that he had. So his diagnosis in no way said to him or to his parents, well, you'll be no good in life. They recognized that he was a bit different and quite brilliant in some areas, and he's done very, very well. So for him, it didn't, the label, the mild label, if you like, didn't influence his life badly. He's done very well out of it. But I have seen people who've just, dare I say, used it, I think, unhelpfully. Almost as an excuse when they haven't been very severe to say, there we are, I can't do anything. And that's what I'm talking about, the self-fulfilling prophecy that was written in the article as well. And I think that's when it's not helpful. So we've got to be very careful, especially with the mild versions of a disease. Is this going to help the person or not? And I remember my dad used to turn it around the other way around. We were talking some medical speak, and he just said, I don't need to know what it's called. Just make it better. So he was anti-labels, but he was very practical. Okay, what's the solution? Not the label. The label isn't the solution. What's the solution? And I thought, that's quite clever, actually. Yeah, we can have a fancy label, but the solution's what counts. So it's a difficult subject, labeling, but there's no doubt that with the massive increase that's been going on, it does look like some people are being labeled, perhaps excessively and unnecessarily.
I think I may have said this before. When I was being diagnosed with my heart, I've been told I have atrial fibrillation. I've been told I absolutely categorically don't. And then I got treated because I definitely do have it. And I'm thinking, I really don't care. Or what? I just want my heart to beat normally. That's all I want. What you want to call it does not. I don't care.
Like my dad, he would approve of this conversation.
Well, yes, because so it's AF, but then there's AF atrial flutter, which I had heart surgery for, as opposed to AF atrial fibrillation. I don't care. Could you just make it better? And can you? I was like, can you just define for us what is ADHD and what is autism? Because I would probably generalizing, which I think many people might. Autism is people who can't quite concentrate but are really clever. ADHD, I always think, well, that's people who just can't sit still. That's how I would really terribly categorize them.
Done very well. I mean, that's a very long discussion itself. Too long for the radio, to be fair. But yes, I mean, I was sort of pointed to a young lad the other day. He's got ADHD, which, as you say, is the ants in the pants, can't sit still, can't concentrate, is disruptive in class, etc., etc. I looked at this boy. He came in, he sat beautifully in my clinic, chatted away nicely, and I'm thinking, I very much doubt that. There's something else going on here. He's not happy with something at home, and we went along a different path. But the classic one is literally all over my room, wrecking my room, fiddling with my computer, trying to pull leads. Hang on a second. I can see this is a problem. If they're treating my room bad now, I can imagine they're absolutely wrecking your house. So autism's a bit different because it's a different way of looking at the world as opposed to ants in the pants. But that's I need an awful lot longer to go into that one. And I think it's not so much the minutiae of the disease really that we're discussing here, but trying to get it right for the individual person. And is a label helpful, especially for the mild cases? That's the one, because if you're not careful, it gives people an excuse not to perform. And I'm a very positive person. I want everyone to do really well, and only give them a label if it's going to help them, not otherwise.
I know I've shared this before, at least once, possibly twice. I was a stay-at-home dad. My youngest son was probably 2-3 years old. And one of the mums I got to know, one of her children, she had 5, one of her children was diagnosed with ADHD, went through the whole doctor. I don't know. How do you even diagnose it? Anyway, this is like 2006-ish. And they were diagnosed properly through the NHS doctor, all of that. And then one of her other children had a really severe issue with food, went to the GP, completely separate. And the GP said, right, you need to do these things. Just all natural food. We just got to take everything out to try and find the trigger of what's going on. So she went to town. It was literally water, bread, and chicken, I think was about it. It was about as simple as it get. And she discovered that the child with ADHD suddenly didn't have it.
Wow.
And it was quite powerful because this child had gone through a full proper diagnosis, definitely ADHD, confirmed GP, big stamp on it. Yes, it is. And it wasn't. It was foods created because inadvertently by changing a diet for the whole family, because he's like, I'm not going to change it for one. We're all going to have the diet. The ADHD disappeared overnight with the foods that she took out for another child.
Yeah. Well, there we are. What a lesson. And I think that's, we can get things wrong. And there's no doubt we can get things wrong, or we're not realizing what, the exact cause of a particular disease is. But it can have lifelong consequences. I'm very glad this one didn't. It can have lifelong consequences, and we can be completely sure and completely wrong, and that's terrifically bad for the patients.
There's no point in going into detail because it's really complicated. But how do you deal with somebody comes to your surgery? I think I don't know. My brother's got ADHD. What do we do? Has he got it? Has he just tell me what to do? Where do you go to get the diagnosis?
Oh, yeah, and GPs don't make the diagnosis. So we take a decent history, and then we send them off to the neurologists who make the diagnosis. And then actually with some of these neurological conditions, that's actually very important. So if you come with mild depression, stress, etc., I don't need to send you to a neurologist. I can deal with that. But if you came with psychotic symptoms, bipolar, schizophrenia, sufficiently serious mental health disease, we get the experts involved, they give us their conclusions, and off we go with the treatment. And it's ADHD, and it's the same. The problem is, certainly in Margate, it can be years, literally years, to get a diagnosis, because neurologists are like hen's teeth. They're very very thin on the ground, and ADHD is enormously over subscribed in terms of trying to get people seen by neurologists. So of course, what do people do? They go online and self-diagnose, like me self-diagnosing my car if it squeaks. By and large, a bad idea for such an important diagnosis. Now, it is the answer obviously is to get much better neurological access. I accept that, but diagnosing yourself for something this important, I don't think is the answer.
So ADHD or autism, these are something in the brain that doesn't work I'm not going to say wrong, but something that doesn't work like everybody else's brain will probably work. There's something different, I guess, of how they're thinking or taking in information.
Or the wiring is a bit different, but sometimes you can't. You don't always see structural changes in a brain. It can just simply be function of the brain is just very different from what we'd expect, and in that case, it's a clinical diagnosis. You look at the person, take the history, watch them, examine them, and think. Sometimes plus or minus brain scans, but sometimes that's all that's required. You've got enough there to say, yeah, that's a history of ADHD, not least if there's 2 or 3 siblings who've got the same problem, or the parents have the problem at the same age and say, oh, he's just exactly like I was 30 years ago. I'm recognizing this. And you go through the history. Yeah, this is a family history of, say, ADHD. But I think, I think the point is tonight, it's not so much how to diagnose it. It's more the mild ones. Is it actually worth diagnosing it, or are we going to hinder that person more than we're going to help them? And that's my concern with some labels.
Can we just touch on a really thorny issue that's very, very much in the press, which I want us to deal with very non-political if possible. But there's a big thing about mental health, about all these lazy people with mental health. They're just loafing about at home. And I've heard every political party's colour saying something along those lines. Okay, but how much accuracy is there in there's loads of mental health? Is it because there are more people with mental health because COVID did a number on a lot of people? I've met some folks like that who still can't leave the house. They're just terrified of germs. So you definitely got that, and we've seen an increase. But how much? I mean, you go as 5.8 million people are disabled by mental health. That's quite a lot in a population of 65, 70 million.
It certainly is. I mean, I think a lot of diseases are better diagnosed than they used to be. So diabetes, for example, classic. Hypertension, people get their blood pressures done now much more than they used to. So you're going to make more diagnoses simply because you go looking for it. But also it's become much more socially acceptable to be, and that's a good thing, to come up with problems, not least in men. People like Prince Harry have really helped with that, and I'm glad they have. But equally, the downside of the other side of the coin is, if you look back to the people in the war who would get on with an awful lot worse situations perhaps than we have these days. So we've lost a bit of mental resilience, I think. So whilst there is some genuine mental health problems, and we recognise, say, post-traumatic stress syndrome much better than we used to, not in war veterans or people who've had terrible domestic violence, whatever. That's really good that we recognise it. But equally, people are coming with what would normally in the past have just been thought to be, well, that's just normal life. There's going to be some stress in life. Stress actually can make us perform better, a bit like when you come to an exam. And a little bit of stress does not equal mental health. And that's one lesson I think the population has to get used to. And I think young people who've been damaged by COVID and, not going out much and they've really developed awful anxiety, need some help. Absolutely, but also perhaps a little bit of a stick as well as a carrot to say, look, this is part of life. You don't want to be in this position in 2, 3, 5 years' time. You need to get out now. We'll support you, but you need to get out and work and meet people. Don't just sit at home on your computer, otherwise things are going to get worse. So a little bit of the stick as well as a carrot, I think.
Which is why I asked you, because I remember a lot. I've shared this story as well. It just came to mind, but I remember I was running an 18+ group, and one of the young lads that we had is about 2021, always brand new clothes, lovely lad, really good temperament, but clearly never had a wash, never been taught about personal hygiene. And although he had clean clothes, you just thought, oh, he's here. And I thought, I don't know. I was only 22 or something, trying to think. I don't know. One of the team we had was a GP, doctor, A&E doctor. And I said, I don't know what to do. Leave it with me, she said. Now, she went off and talked to him. We were there and it's fine. But I think sometimes doctors have a way of cutting through without being rude to get to a point to help someone the quickest. Does that make sense?
It does. Perhaps there's practice, but also sometimes this is where labels are helpful. You've got a label of, oh, I'm a doctor. I don't know whether it's quite as much as it used to be, but people, oh, I'm going to listen to this guy, this woman, because they've got the magic 2 letters before their name. And so sometimes you can get away with things perhaps that other people can't. And you can say, from a professional angle, I think this is bad for you. And you can approach it like that rather than thinking, my goodness, you smell. It's terrible.
Yeah.
As a doctor, we have a bit more armory in that sense.
I wouldn't have said that, but I don't think I would have been quite successful as this lady was at really delicately, gently coming alongside this guy. And it's the come alongside part that churches can do. If someone's struggling for mental health, they're stuck at home. Hey, be a friend. Mental health is an issue. Knowing when you go to your doctor, we've touched on that. ADHD and autism. It's a complicated issue. I wasn't aware that we needed neurological brain doctory people, but I think that does demonstrate something of a caution that we need to take with this. I think labels can help some people. Having a doctor is useful if you've got somebody who's injured. Here's a doctor. I remember somebody said, oh, police constable, you'll do. You can advise me. And that's fine. These labels can be really helpful, but also they can be limiting, which is one of the first things. I think it was the author of that article said is if we're not careful, the label, whilst being potentially helpful, can actually limit us, because then we can't do this, we can't do that, which I know we've touched on a few times. So I guess, as ever, it's caution. But churches can do a lot to help people, to come alongside them, because we know the NHS, doctors, nurses around the world pretty much are really struggling. That we're UK based, but that's where churches can come in. And you don't have to be a GP or a qualified nurse to say to somebody, let's go out for a walk, or are you scared about going to interview? I'll come with you. I'll sit there with you. I'll help you. I remember a church in Shrewsbury went way past that. They had somebody came and did haircuts for the homeless. They had this rack of suits and proper dress suits for women so they could go to an interview looking good. They had computers. They would help them looking for jobs and emailing and all that stuff. And they really did walk alongside, from someone saying, I'm homeless, to here's a suit, here's a clean, here's a shower, here's some help, here's some interview prep, and we'll walk with you. We'll even give you a lift to the place you're going for the interview. So they really did go through, because that is something that churches can be epic at.
One of the most wonderful verses in the Bible, isn't it? It's John 10:10. Jesus said, I come that they may have life and have it to the full, or have it abundantly. And whether you've got ADHD, autism, mental health disease, or whatever, we should be trying to live that out and helping people have life to the full, maximize whatever position they're in, because Jesus does, and if he's living in us, then we should be able to do the same.
Yeah, but you can understand when people don't get the diagnosis they want, or they're told, oh, it's 2 years. A friend of mine recently, oh, yeah, it's 2 years before we'll look at your child for ADHD. And they're thinking, what do I do in the meantime?
And certainly in my patch, childhood mental disease is so much more difficult to treat than adults, because we're not, as GPs, we're not really allowed to initiate childhood treatment, whereas we can with adults for most cases that come our way. And it's a real problem because, as you say, it's 2-3 years, whatever, before they get seen, and it's quite unacceptable.
Yep. But if we can't fix that, we can pray and walk and be loving and kind and compassionate. And actually, it's the fruit of the spirit, isn't it? Self-control and compassion and goodness, and it's all those things to the people around us.
Yeah. No, well, thank you for mentioning it. Sometimes if I do a medical talk, I forget the Christian angle on it, and there's almost always a Christian angle on it. But
I would say,
yeah, thank you for bringing that up.
Well, it's part of the bit I do. I can't do the medical bit. No one would want me to. That would be an interesting exercise that we're never ever going to go to do. Richard, thank you. If you've got a question for Richard on that, anything we talked about, you can ask some questions. You can ask any of the questions, topics in the news. hello@pure247radio.org is the email address. hello@pure247radio.org. Richard will be back with us in the new year. But if you're missing him, you can read Richard in the magazine.
Well, a seamless plug. Seamless and shameless, but absolutely fine. And yes, please do read. I mean, I read the magazine because I love other people's articles. I don't even mind my own. But it's it's a very wide-ranging, interesting, beautifully put together, very professional, and you'll feel better having read it.
That's the plan, and that's what we get told, which is great. Richard Scott, the good doctor. Thank you, sir.
Andy, thank you, and have a very good Christmas.
You too. Bye-bye.
Cheers, mate.